Fundamentals of heart health. Cardiovascular diseases, including coronary artery disease and stroke, rank first among the causes of mortality worldwide. The majority of them can be prevented through lifestyle changes and control of key risk factors. The development of cardiovascular conditions is potentially possible in any person, with certain factors increasing the likelihood of their occurrence: elevated cholesterol, arterial hypertension, diabetes mellitus, smoking, excessive alcohol consumption, excess weight, low physical activity, overeating. Additionally, age and the presence of cardiovascular diseases in close relatives also play a crucial role in risk formation. Risk-enhancing factors: for women, age over 55 years; for men, age over 45 years, the presence of heart diseases in the father or brother before reaching 55 years of age; heart disease in the mother or sister before the age of 65. A positive aspect is the ability to significantly reduce the probability of developing cardiovascular diseases through timely and targeted actions. Maintaining physical activity is crucial for heart health, as the heart muscle requires regular exercise for efficient functioning. Exercises that accelerate the heartbeat can be varied, including walking, dancing, or cycling. It's advisable to start with accessible activities, such as short walks or simple exercises, especially if there was no prior experience with regular training. An initial threshold of 5 minutes of activity per day can serve as a starting point for improving physical condition, and over time allows for increasing both the volume and intensity of the exercises. It is recommended to aim for at least 30 minutes of moderate intensity physical exercises every day. This will help keep the heart muscle toned and contribute to overall health and well-being improvement. Understanding the importance of monitoring key health indices. Discussing the critical values of low-density lipoprotein, LDL, cholesterol and high-density lipoprotein, HDL. Cholesterol is justified by their impact on the condition of the arteries. The accumulation of plaques, resulting from the imbalance of these indicators, can lead to the development of cardiovascular diseases, including heart attack and stroke. Health standards set the maximum value of total cholesterol at less than 100 mg per deciliter or 5.5 millimoles per liter. Cholesterol levels should be monitored with a certain frequency, at least once every 5 years for individuals at low risk of developing cardiovascular diseases, for men over 35 years of age and women over 45 years of age, and at an earlier age for those at high risk, men aged 20 to 25 years, women aged 25 to 30 years. Obtaining detailed information about cholesterol can contribute to disease prevention. Blood pressure is often called the silent killer because of its ability to go unnoticed when high, which, in turn, can harm health, causing a heart attack or stroke, and in extreme cases lead to death. The optimal blood pressure is considered to be 120/80 mmHg. In cases where cholesterol or blood pressure levels exceed normative values, it is critically important to take appropriate measures to correct them. Maintaining a healthy weight is a key aspect of preventing heart disease. Excess weight leads to an increased risk of cardiovascular disorders associated with high blood pressure, elevated levels of lipids, and glucose in the bloodstream. Changes in body mass directly correlate with fluctuations in cardiovascular risks. The definition of overweight and obesity is determined through the body mass index, BMI, calculated by dividing an individual's body mass, in kilograms, by the square of their height, in meters. Individuals with a BMI of 30 or higher are diagnosed with obesity, while a BMI of 25 and above indicates the presence of excess weight. The most important strategy for maintaining a normal weight is balanced nutrition combined with regular physical activity. These methods contribute to improving overall health and reducing the risk of developing cardiovascular diseases. Optimizing nutritional diet. The foundation of a diet that supports cardiovascular health consists of consuming nutrient-rich foods while limiting saturated fats, excess sugar, and salt. Chocolate, contrary to common belief, has a positive effect on heart health due to its cocoa content. Cocoa is rich in antioxidants that can increase the level of beneficial cholesterol while reducing the negative kind and optimizing blood clotting processes. It is important to consume in moderation. The recommended serving does not exceed 50 grams per day. Walnuts are a valuable source of omega-3 fatty acids, which effectively help to normalize cholesterol levels. When choosing cooking methods, preference should be given to healthier options. Avoid methods that involve using cream or clarified butter. This applies to meat, fish dishes, and vegetables. It is advisable to stick to baking, grilling, steaming, boiling, or stewing. For flavoring dishes, it's better to use natural spices, aromatic herbs, and lemon juice, which allows for reducing the need to add salt, cheese, or cream. To maintain health and well-being, it is recommended to avoid situations that can lead to stress. One way to reduce stress is to practice slow and deep breathing for several minutes each day, which helps in relaxation and can have a positive effect on lowering blood pressure. Quitting smoking plays a crucial role in improving cardiovascular health. Smoking contributes to the development of atherosclerotic plaques, damages the endothelium, a protective layer that lines the inner surface of blood vessels and the heart, and impairs the function of both coronary and peripheral arteries. Smoking also increases the risk of thrombosis, causes insulin resistance, and chronic inflammation, which, in turn, can accelerate vascular disorders. Ceasing this habit significantly reduces the likelihood of cardiovascular diseases and mortality in individuals with pre-existing heart conditions as well as those without them. Reducing alcohol consumption or abstaining from it altogether can also positively affect cardiovascular system health and overall wellness levels. Many believe that consuming red wine can benefit heart health, but it's important to note that this isn't a guaranteed truth. Scientific research has yet to provide conclusive evidence supporting the positive effects of alcohol on the cardiovascular system. Therefore, it's advised to limit its consumption. Excessive intake of alcoholic beverages can lead to various adverse effects, including disruptions in heart rhythm, high blood pressure, an increased risk of stroke, liver diseases, and certain types of cancer. Regular and thorough hand washing with soap throughout the day is a crucial preventive measure for maintaining heart health. Pathogens, including bacteria, fungi, and viruses, can cause endocarditis, an inflammation that affects the inner lining and valves of the heart. Moreover, some infectious diseases, such as angina and influenza, have the potential to provoke serious heart complications. Seek medical help in a timely manner. Symptoms indicating a heart malfunction, particularly myocardial infarction, can manifest unexpectedly. Sometimes, it takes hours, days, or even weeks for these symptoms to develop. Myocardial infarction occurs due to the cessation or significant reduction of blood supply to the heart muscle. Under such conditions, ischemia or necrosis of the heart muscle can occur, posing a serious threat to life without immediate medical intervention. Common symptoms of infarction include a sensation of pain or discomfort, compressing and expanding feelings in the central or left part of the chest, painful sensations or discomfort in the upper body, including arms, back, shoulders, neck, jaw, or area above the navel, breathing problems, shortness of breath, nausea, vomiting impulses, abdominal pain, a sensation of heartburn, dizziness, feeling of faintness, unusual fatigue, the appearance of cold sweat. It's important to note that during a heart attack, one or several of the aforementioned symptoms can be observed simultaneously. Taking active steps today can help reduce the likelihood of developing cardiovascular diseases in the future.